Doctors beg men over 50, don't ignore these prostate cancer signs. Prostate cancer is a leading cause of illness and death in men worldwide. But the good news is catching it early offers the best chance for effective treatment and cure. That's why it's absolutely critical for men to recognize subtle body changes that may be early clues to prostate cancer brewing underneath the surface. Don't downplay prostate symptoms or delay getting checked thinking you're too young or it's just part of normal aging. Always tune into the warning signs and discuss any concerns with your doctor promptly. Early detection saves lives. In this video, we'll carefully overview the top 10 early signs of prostate cancer that all men need to know. We'll also briefly highlight some key screening tests used to detect prostate cancer in its early curable stages before obvious symptoms develop. Let's start taking steps now to safeguard your prostate health for the vibrant years ahead. More frequent urination and nighttime. Urination. Needing to urinate more often than usual, especially getting woken up by the urge to pee throughout the night, reflects an enlarging prostate. As the prostate grows bigger with cancer, it presses on and squeezes the urethra it surrounds. This causes obstruction that inhibits urine flow, leading to retention and urgency. Along with increased nighttime waking to urinate, you may notice needing to pee more often during the daytime. If you find yourself making frequent bathroom trips and this pattern persists, bring it up to your physician. An enlarging prostate requires further evaluation to rule out cancer. Weak urinary stream, hesitation and dribbling. Related to urinary frequency and retention, you may observe your urine stream slowing down and coming out with less force. It may start and stop intermittently instead of flowing steadily. This reflects incomplete bladder emptying since the enlarged prostate is blocking urine outflow. Straining, taking longer to fully void, and dribbling urine after you feel finished are also common prostate issues. If your urinary stream seems weaker with constant dribbling, the likely culprit is prostate enlargement impinging the urethra. See your doctor for prompt evaluation of these troubling urinary symptoms. Blood present in semen or urine. Seeing pink, red, or brown-hued urine, which is called hematuria, indicates blood mixing with the urine. Similarly, blood traces noticed in semen known as hemospermia may arise from prostate problems. Do not ignore unexplained hematuria or hemospermia. Prostate cancer, especially in the early stages, can cause minor bleeding into the urine or semen as tumors infiltrate the prostate and disrupt nearby tissues. Any amount of blood, even microtraces, deserves further scrutiny. Discuss with your physician promptly to pinpoint the organ through examination and tests. Discomfort or aching in the lower pelvis, upper thighs, and lower back. Aching, heaviness or dull pain in the lower pelvis and upper thigh regions, rectum or lower back can result from an enlarged prostate pressing on nearby nerves, muscles, and tissues. Prostate cancer tends to grow and spread along the pelvic anatomy. Advanced cancer that has metastasized or spread to the bones also commonly causes lower back, hip, and pelvis pain. Pay attention to any unusual sensations such as twitching, numbness, or tenderness around the legs, buttocks, or lower back, and discuss with your doctor. Erectile, dysfunction, and reduced libido. Prostate swelling and cancer can impede blood circulation and nerve signals required to achieve and maintain erections. Gradual onset of erectile dysfunction and diminished interest in sex tends to develop as the prostate is affected. Don't overlook or downplay gradual loss of libido and worsening impotence over time. Bring it up to your physician, as it may be tied to prostate changes. Breaking the silence by discussing sexual symptoms leads to earlier detection and better outcomes. Discomfort or pain during ejaculation and reduced. Ejaculation strength related to erectile dysfunction. You may notice increasing pain or discomfort when ejaculating, and your semen volume may decrease. This happens because the prostate gland plays an integral role in ejaculation. When the prostate is inflamed or cancerous, ejaculation function is disrupted. Report new, painful, or unpleasant ejaculation experiences to your physician for evaluation. Reduced semen volume or watery ejaculate can accompany prostate illness as well. Don't downplay these troubling symptoms. Discuss them promptly for proper diagnosis. Loss of bladder or bowel control. In more advanced prostate cancer, sudden loss of bladder and bowel control marked by urinary leakage or stool incontinence can occur if the cancer invades the lower spine, where nerve signals arise that control the pelvic floor. However, there are other potential causes like diabetes or UTIs. See your physician promptly for proper evaluation if you notice any unexplained fecal or urinary incontinence. Regaining bladder and bowel control depends on prompt treatment. Prostate cancer should be ruled out since it commonly spreads to the pelvic region. Unexplained weight loss, fatigue, or feeling unwell. Gradual, unintentional weight loss and feelings of chronic tiredness, listlessness, or just feeling unwell can signify prostate cancer in later stages. Tumors produce immune factors and upset metabolism, contributing to appetite changes, unexpected weight loss, and fatigue. Pay attention if your pants are loosening, your muscles look more flaccid, and your energy levels take a nosedive. Don't downplay these red flags. Discuss them with your doctor to uncover whether prostate cancer may be silently affecting your well-being. Swelling or discomfort in lower legs or feet. Prostate cancer that has metastasized or spread to lymph nodes and tissues can cause fluid buildup and swelling in the lower extremities and feet. Edema results from problems with lymph drainage when nodes are affected. In addition to visible swelling, you may feel heaviness, numbness, or tenderness as cancer spreads to pelvic lymph channels. Discuss any unexplained lower limb swelling or discomfort with your physician promptly for further evaluation. Family history of prostate, breast, or ovarian cancer. Having first-degree family members like your father or brother diagnosed with prostate cancer increases your risk substantially. Additionally, female relatives with breast or ovarian cancer also raise risk. Talk with your doctor about when to begin screening based on family history. Genetics play a key role in prostate cancer susceptibility. Starting screening at age 40 or earlier may be recommended for those with first-degree relatives who had aggressive prostate cancer diagnosed at a young age. Understand your inherited risk based on your family's specific cancer patterns.